Hey, it's Dr. Jay with HealthWorks Chiropractic. Today I thought it'd be interesting to go over what we see on X-ray and how that could correlate to some symptoms that patients may be having. So, on this particular X-ray, this gentleman came in with really bad low back pain, could hardly get out of bed, couldn't move, shooting pain down the leg, very acute condition. Just kind of came on out of nowhere. He was working, bent over, kind of felt the pinch. The next day he woke up and he felt like that. So we did an evaluation on him. Based on the evaluation, we took some X-rays. And what we found in the X-rays was his lower back was really crooked. What you want to see is that spine to be super straight, and you can see how that's really tilted off to the right. So this patient, look at this patient from behind, so left side, right side. So you'll notice the hips are really tilted, really taking that low back to the right and then coming back to center, putting just a ton of pressure on that nerve that comes out of that low back. And I'm going to take this to a side view so you can see what the side view looks like. This is this patient from the side. When I say the nerves, where they come out from these little holes right here. And the part that's getting pinched on him is right down through here. Correlate that back to the initial view. Where I was pointing to was right through here. So we also noticed with his pelvis, his hips are way off. So his hips are sitting like this. And you'll notice too how this left hip appears to be much wider than that right hip. So what that means is that pelvis is rotating. So let's say my hands are these hips, okay, and the camera is the X-rays. So if the pelvis has no rotation, you can see both of my hands relatively the same. But if I rotate them, you see more of one than the other. And that's what's happening right there as well. So with this gentleman, we'll utilize adjustments, low back adjustments with the pelvis and the low back to realign the lumbar spine. We'll do some therapy such as muscle stem to reduce muscle spasm through that area. Also some decompression, get some of that disc pressure out of there as well. So if you have any questions or if you have an acute issue of low back pain, it could be something like that going on, give us a call, 615-791-9917, or look us up at healthworkschiropractic.net.